A good day to you all. My name is Dr. Milan Matthew Abraham. I am an oral and maxillofacial surgeon working with Richardson's Face Hospital. Today we will be discussing about obstructive sleep apnea, known as OSA, and the role of corrective jaws surgery in the management of OSA. So we will try and address this issue by answering the most commonly asked questions that we have received on the social media. I'm assuming the targeted audience for this particular question answer session would be the layman, and I will try and keep my answers as simple as possible. Jaw surgery is performed in sleep apnea when the positioning of the jaws are more posterior or backward than when compared to a normal person. So when you do a corrective jaw surgery, we bring the jaws forward and keep it in its right position. Now what this does is the muscles attached onto the jaws stretch when we do this forward placement, thereby opening up the space in your throat or your airway, and hence curing or treating your sleep apnea. So sleep apnea, as we are discussing today, is specifically obstructive sleep apnea when there are certain structural factors in your body, specifically things like backward placed upper and or lower jaws, large tongue, long soft palate, obesity, etc., causes an obstruction, a physical obstruction for the movement of air through your airway. So when we do jaw surgery, we bring the jaws forward. Now, when the jaws are brought forward, space is cleared inside the airway, clearing up space for air to pass through. So the positioning of the jaws when they are backward pushes back on the throat, thereby causing an obstruction or narrowing. And this narrowing is what is exactly corrected when we are doing a maxillomandibular advancement surgery or a jaw surgery. The requirement of a jaw surgery for sleep apnea essentially depends on the severity of the problem. Jaw surgery is often indicated for patients who have moderate to severe sleep apnea, which is in turn indicated by something known as the apnea-hypopnea index or the respiratory distress index. The other group of patients for whom jaw surgeries are performed are ones for whom more conservative treatment options have been tried and failed. Because when compared to the more conservative treatment option, maxillomandibular advancement or jaw surgery has been proven to be curative. A jaw surgery is for sleep apnea is performed on both the maxilla and mandible most commonly, and this comes with its own recovery time because it is a major procedure done under general anesthesia. The most common or recommended recovery time is around 3 weeks to a month. After about a month, the patient can start their own normal activities without any problems. They might have some neurosensory recovery period wherein the patient might experience some numbness in their lower lip and on their face. Again, the recovery time for that is around 3 months. And it is a completely reversible situation. But there are no permanent risks or damages that the patient can have due to a maxillomandibular advancement surgery or a jaw surgery. As mentioned earlier, because the most commonly performed jaw surgery for sleep apnea is a bijaw surgery or involving both the upper and lower jaws, the recovery period is around 1 month. In most circumstances, in 99% of circumstances, the patient does not need a CPAP after jaw surgery for OSA. Immediately after surgery, the changes will be seen. So in most patients who need a jaw surgery for sleep apnea, The problem is also associated by certain facial features like having a short face or having a concave profile, having a small chin. So these are all issues which will be corrected simultaneously with the jaw surgery. The patient, as a benefit to having an improved breathing, will have an extremely aesthetic and a proportional face. Jaw surgeries are indicated in sleep apneas of moderate to severe, and in such cases no other treatment is going to be curative. So the first step would be to assess the severity of your sleep apnea, which is done using a sleep study, through which we'll get a respiratory distress index or an apnea hypopnea index. These both indices help us decide the kind of surgery or the treatment that is required. Secondly, along with assessing your sleep pattern, we will also use some diagnostic imaging such as CT scans and lateral cepts, which will help us plan your surgery. And also certain dental models or casts will be made in order to give you a good maxillary mandibular relationship after the surgery. Jaw surgery for sleep apnea does not directly contribute to weight loss or positional changes. Having said that, the repositioning of the jaws can lead to improved head and neck posture. Though it is not a direct outcome, cases have been seen, but for weight loss, patient needs to look for more targeted therapies. Maxillomandibular advancement for jaw surgery is curative and permanent. The amount of airway improvement that the patient gains after the surgery does not go away until and unless the patient has an extremely dramatic weight gain. For up to a month after your jaw surgery, which is the previously mentioned recovery time, you are expected to be on soft diet, after which you can go back to your normal activities, your normal diet, and everything should be back to normal. But then again, if your obstructive sleep apnea is compounded by obesity, lifestyle changes including exercise and healthy eating are recommended. Once you're a patient who has been diagnosed with sleep apnea, you need to come to us regularly, especially after the surgery is done, maybe up to a year or maybe yearly visits after that, so that we can see how well it's settling in. And more importantly, you need to keep an eye out for your general health. And instead of worrying about the face, you need to keep an eye out for your general health, because as far as the movement or the surgery that we do, it is a very permanent and it is a very stable procedure. You're not expected to have any relapses. Having said that, yearly follow-ups are recommended. Hope the small session we had enlightened you about what obstructive sleep apnea, and hope I was able to answer most of your queries in a reasonable manner. Thank you and have a nice day.